What's going on, everyone? Welcome back to my channel. In today's video, we're going to be looking at rehab exercises for degenerative disc disease in the neck. So if you've had an MRI or an X-ray and seen evidence of this, maybe you have pain in your neck or pain that radiates down one arm, then this video will be for you. So degenerative disc disease is most common in the low back and in the neck region. I covered issues in the low back last week, so if you need that video, I'll put a link for it down in the description. When we look at the cervical spine, there are 7 levels in the neck. The level that most commonly experiences degenerative disc disease is the C5, C6 level. So if we count down, we've got C1, C2, C3, C4, C5. So it would be in between the C5 vertebrae and the C6 vertebrae, so it would affect the nerve roots that come out between those two vertebrae. So again, you could have just neck pain, or you could have nerve pain that radiates down one or both arms. With degenerative disc disease, the discs right here lose water, and so they shrink in height. And when that happens, it causes this little hole where the nerves come out, the intervertebral foramen, to become smaller, which again can compromise the nerve and cause radiating pain down the arm or in the neck. Now, the really important thing to know about degenerative disc disease is that in the neck, we have research showing that it starts occurring, there's evidence of it starting in our mid-20s. By the time people get into their 40s and 50s, almost 90% of people have evidence of disc degeneration, and a lot of those people don't have pain. So I always tell patients, just remember, having evidence of this is a part of the normal aging process. It might not cause pain, so try not to freak out about it if somebody tells you about it on an MRI or an X-ray. If you have neck pain, then go through the exercises that I'm going to show here today. With degenerative disc disease in the neck and the low back, soft tissue mobilizations that address the muscles on the posterior side of the spine, the back side of the spine, can be really helpful. So you could just go see a massage therapist or an orthopedic physical therapist who specializes in manual therapy. Another thing to do is to take a yoga block, works well, and a massage ball. An even better tool than a massage ball is something called a peanut massager. It's kind of 2 massage balls hooked together, and it's great for getting both sides of neck muscles. I'll put a link down in the description if you want to get one of those. I don't have one to show it, but essentially 2 massage balls hooked together. So what you're going to do is take your massage tool. If I've just got one ball, I'll work both sides of my neck one at a time. I'm going to lie on my back here and put my head kind of right above the yoga block, and then the massage ball will go in between the yoga block and my neck. This is a great way for getting pressure on these neck muscles that run basically from the base of our skull down the whole length of the neck. So you can just kind of move yourself on the ground and just kind of move one segment at a time, thinking about those vertebral bones just slowly kind of shifting up your neck, and basically doing a self-release or self-massage of your cervical extensor muscles. You can just hang out and pause when you find a spot. I've got a tender spot there. I'll just kind of hang out, take some deep breaths, and try to kind of visualize that area relaxing. And then again, like I said, if you only have pain on one side of your neck, you could do just on one side, but a lot of times people have it on both sides, so you just move the ball over and work the other side. I would try to spend somewhere around 1 to 3 minutes kind of massaging these muscles. It's just sort of based on how your body responds, but just kind of work through there, and this can be really helpful for reducing pain. Okay, so that's our first one, a soft tissue mobilization or self-myofascial release of the cervical extensor muscles. For our next exercise, we really want to focus on neck mobility exercises. With degenerative disc disease, one of the most important things you can do is just to frequently move throughout the day. Our neck has 6 directions of movement, so just try to run through these 3 to 5 times throughout the day. If you're sitting at your desk, just go through each movement, maybe 5 to 10 times each direction. So the first movement here is going to be side bend or lateral flexion. So you're just going to take your ear to your shoulder, just hold it for a second or two, and then go the other direction. So those are 2 of the movements of the 6, left and right side bend or lateral flexion. Then you're going to do left and right rotation. So you're just essentially looking over each shoulder. Rotation is often limited in people when they have neck pain, especially issues that affect the discs or with arthritis. So this is a really important one to work, both left and right rotation. We're supposed to get about 80 degrees. You should be able to look almost all the way over your shoulder. So if it's limited, make sure to work it. And then last, our flexion extension. So flexion is chin to chest, kind of looking down, seeing if you can get your chin as close to your chest as possible. And then extension is looking up. And with this, we should be able to get pretty close to our face parallel with the ceiling. So just work back and forth through those two. Okay, so those are our 6 neck mobility exercises, the 6 movements available to our neck. So again, just throughout the day, 3 to 5 times more if you need to. Just work through those. Our next exercise is a nerve mobilization for the median nerve. The median nerve is the biggest neck nerve that comes out of our neck. It goes all the way down through our carpal tunnel, and it actually has nerve roots that come from that C5, C6 area that I said earlier is the most common level of disc degeneration. When the C5, C6 nerve roots are affected, people will get radiating pain into kind of their shoulder, into their bicep region, maybe also the top of their forearm and hand. So for this nerve mobilization, you're going to do it really on the side if you just have nerve pain on one arm, but you can do it on both. You're going to put your arm out so your palm is up, and we're going to do a little combined movement here. So when my wrist goes down to extension, I'm going to move my head towards my hand. That's going to put the nerve on slack here and tighten it at my wrist. And then I'm going to switch. So now when my wrist and elbow move into flexion, the nerve gets put on slack, and I'm going to then tighten it at my neck. So this is called nerve flossing. It's sort of like pulling floss between your teeth. In this case, we're pulling the nerve toward the wrist, and then we're pulling it back up toward the neck. These types of nerve mobilizations have been shown to help reduce nerve pain, and they can improve blood flow and nutrient delivery to the nerves. So you're going to go back and forth 10 to 15 times. And again, this is one you could do 3 to 5 times throughout the day just to help improve the health of the nerve. Okay, so that's our third exercise, a median nerve mobilization. Before I get into the last exercise, just want to mention that my book is out and available on Amazon and Barnes & Noble. The book has programs for the most common issues we see in physical therapy. Each body region has its own chapter. Today we're talking about the neck and disc degeneration. And so if we go back, there is a head and neck chapter. This neck pain program, the first program, is going to be really a great one if you're suffering from degenerative disc disease. It talks about strains, whiplash injuries, arthritis, issues in the neck, and every program has pictures of me doing the exercises and walks you through 3 phases. Very similar to if you were to come to see me in physical therapy and I was to build a program for you. So the programs are much more comprehensive than my YouTube videos, and again, the whole body is covered here in the book. So I basically created it so that you could manage your own pains and injuries at home. So if you'd like to get a copy, I will put a link in the description. For our last exercise, we're going to start strengthening the neck muscles in sort of a low load fashion, not too stressful. For this, we're going to use a piece of TheraBand. There are, on Amazon, you can get packages of this in different colors for different resistance levels. Again, I'll put a link down in the description if you want to get some. So for this exercise, we're going to do sort of a chin tuck to strengthen some of, again, the neck muscles on the back of the neck and even some on the front of the neck. You're going to take that piece of TheraBand and wrap it around your head, sort of in line with your eyes and your ears. And what you're going to do is put it on tension. You're going to kind of let your head go forward, sort of almost like you're slouching. And then you're going to push into the band, tuck your chin like you're giving yourself a double chin, and pull yourself sort of up into a more neutral posture. And then let your head drop back forward, and then use those neck muscles to tuck the chin and pull up. So this works some of our flexor muscles in the upper part of our cervical spine when we tuck our chin, and then it works some of the cervical extensor muscles on the back of the neck down in the lower part of the neck. So it's a great exercise for training just sort of some of our postural muscles and strengthening the neck muscles. You'll do a little isometric, so at the back position, hold for a few seconds, and then slowly drop forward. Don't let the band snap you, and then tuck and lift again. Just move through the range of motion that's comfortable for you. If you're having nerve pain, then going all the way back here actually might be a little uncomfortable, so just go as far as you can, and over time look to see if you can improve. With this one, I would go for 10 to 15 repetitions and try to complete it 3 to 4 times throughout the day. Okay, you guys, those are a few exercises that often help people with degenerative disc disease in their neck. Give them a try, and if you have any questions, put them down in the comment section. I will try to get back to you. All right, see you in the next video. Bye.